You responded to the base BX for a 32-year-old female experiencing dyspnea.
BSI is my scene safe.
Yes.
My number of patients is 1. My nature of illness is dyspnea. I'll have ALS on standby. I'll consider C-spine stabilization, but not take it at this time. What do I see, smell, and hear?
See a female patient sitting in the tripod position, struggling to breathe.
Noted. My general impression on my patient is poor. Hi, ma'am. I'm Sergeant Hatch from Med EMS. Can I help you?
Yes, please help.
Do you know your name?
Jamie.
Do you know where we are?
We're in the BX.
Do you know what time it is?
7:59.
Can you tell me what happened?
I was eating a sandwich.
Noted. My patient is ANO times 4. Ma'am, why'd you call me here today?
I was just eating and then I started having trouble breathing.
Noted. My patient is talking to me, so my airway is open, clear, and secure. Moving down to breathing, I'll quickly expose my patient's chest, making sure that nothing compromises breathing. I will also quickly get a breathing rate and quality, as well as an SpO2 for no longer than 10 seconds on my patient. What is it?
Breathing is rapid and labored, and SpO2 is 92%.
Do I have a number or no?
Not for respirations.
Noted. Due to that SpO2 and the rapid labored breathing, I will go ahead and set my patient up on an NRP at 15 liters per minute. Hey ma'am, have you ever had any oxygen before?
No.
Okay, we're just gonna put this on you to help you breathe a little bit better. It's just gonna sit right over your nose and your mouth, okay?
Okay.
I will fill out my reservoir bag. Is my bag filled?
Bag is filled.
Noted. I'm just gonna put this around you, okay? Moving down to circulation, I'm just gonna quickly scan my patient's body looking for any life-threatening bleeding. I'm also going to get a pulse, rate, rhythm, and quality for no more than 10 seconds, as well as the skin color, condition, and temperature on my patient. What is it?
No profuse bleeding, pulse is tachycardic and thready. Skin is flush, moist, and warm.
Noted. I'm going to go ahead and treat my patient for shock. My patient's going to be a high priority for transport. We'll go ahead and transport patient immediately. Hey ma'am, what were you doing when all of this started?
I was just eating my lunch.
Does anything make this better or worse?
When I breathe.
It makes that better or worse?
Worse.
Worse. Can you describe what you're feeling?
Just tightness in my chest and it's hard to breathe.
Is what you're feeling moving anywhere?
No.
On a scale of 1 to 10, 10 being the worst thing you've ever felt, can you rate this for me?
It's an 8
And then how long has this been going on for?
for 30 minutes.
Do you have any allergies?
I'm allergic to nuts.
Any meds that you take?
I just have a EpiPen and ibuprofen.
Do you take that ibuprofen as needed?
Yes.
Any past medical history?
I'm allergic to nuts and I just have chronic pain.
What was the last thing that you ate or drank?
A sandwich and a cookie.
And then anything out of the ordinary leading up to this?
No.
Noted. Any chance that what you ate for lunch could have had some nuts in it?
Probably the cookie.
Okay, and then have you taken your Epi today?
I haven't. I don't know how to use it. I've never had to use it.
Okay, we'll get it handled for you. Moving down to my physical assessment, so I'm going to go ahead and inspect the pulmonary system. Again, just opening up my patient's chest, making sure that nothing compromises breathing here. I will go ahead and I will also take lung sounds mid-clavicularly, mid-axillary, as well as posterior bilaterally. I will note the position that my patient is sitting in their effort to breathe.
Wheezing in all quadrants, no injuries.
Noted. I will go ahead and inspect my integumentary system. Quickly just scanning the body, looking at the skin for any decap, BTLS, deformities, contusions, abrasions, punctures, penetrations, any burns, tenderness, laceration, swelling. I will look for any insect bites, any hives, any facial, any neck edema. If a stinger is found, I'll remove it with a rigid object immediately. Do I have any findings?
You find hives on the neck and facial and neck edema.
Noted. I'm now going to go ahead and get my baseline vital signs here. So I'm going to be looking for blood pressure, pulse, respirations. I'm going to look in her eyes to make sure that they're pure, pupils equal round reaction to light, skin, color, condition, temperature, SpO2, as well as the blood glucose level. I'm just going to put this on your arm, okay? Patient's blood pressure is 116/72. Hey ma'am, I'm just gonna go ahead and have you cross your arm right over your shoulder for me, okay? Can we actually switch arms? Great, thank you so much. My patient's pulse rate is 72, respiratories are at 14. I'm gonna go ahead and check the eyes. Hey ma'am, can you go ahead and look at my forehead for me? Eyes are pearl. I'm gonna check your skin. Can you put out your hands for me? Checking that SpO2 and then a blood glucose level if indicated. Can I go ahead and get my baseline set of vitals?
Right, no blood glucose indicated. Blood pressure is going to be 102/72. Pulse is going to be 124 and bounding. Respirations are going to be 26 and labored. Eyes are pearl. Skin is red, hot, diaphoretic. And SpO2 is 92%.
Noted, my field impression is that my patient is suffering from anaphylaxis. I'll call medical control to see if I can intervene with my patient's EpiPen.
Permission granted.
Noted. Hey ma'am, do you have that Epi on you?
Right here.
Okay. I know you haven't taken this before, but we're gonna walk you right through it. So I'm just gonna go ahead and verify drug dose, patient route, and time. I'm gonna check the expiration date, make sure that there's no discoloration to my Epi. I'll go ahead and remove the blue cap, and then I'm gonna expose this part of your thigh right here. So I will go ahead and push this to the lateral aspect of the thigh. I will push until a click is heard. I'm gonna hold for 3 seconds. I'm gonna go ahead and remove. I'm gonna have you rub that area for 10 seconds. I'll dispose this into a sharps container. I will wait 5 minutes, and now I will go ahead and reassess my patient's second set of vital signs.
All right, blood pressure is going to be 116/82. Pulse is going to be 128 and strong. Respirations are going to be 18 and deep. Eyes are pearl. Skin is pink, warm, and dry. And the SpO2 is 96%.
Noted. Hey ma'am, how you feeling?
So much better.
Good, I'm glad to hear that. So I'm gonna go ahead and reassess my patient, reassessing vitals, interventions, primary, secondary assessment every 5 minutes en route, and I'm good to give my verbal report now.
Okay, go ahead.
So I responded to a 32-year-old female at the BX with a chief complaint of dyspnea. I did find her in the tripod position. My patient was ANO ×4. On my first impression, she did have rapid and labored breathing with an SpO2 of 92%, so I did go ahead and put her on an NRB at 15 liters per minute. My patient does have a known allergy to nuts. They said that they were just eating lunch when it started getting harder and harder to breathe. They said it was just centralized in their chest. It was an 8 out of 10 pain, has been happening for about 30 minutes. Like I said, there is a known allergy to nuts. They do take Epi and ibuprofen as needed. Past medical history of that nut allergy and chronic pain. Last oral intake was a cookie. Clarified with the patient, she did say that there was a possibility that the cookie that she ate did have nuts on it. For my physical exam findings, for the pulmonary system, there was wheezing found in all quadrants. For my integumentary system, there was hives to the neck as well as facial and neck edema. Baseline set of vital signs: blood pressure was 102/72, pulse was 124 and bounding, respiratories were 26 and labored, eyes were pearl, skin was red hot and diaphoretic, SpO2 was at 92%. My field impression was that my patient was suffering from anaphylaxis. Went ahead, called medical control to see if I could intervene with the epi. Administered the epi 5 minutes after second set of vital signs. Blood pressure was 116/82. Pulse was 128 and strong. Respirators were 18 and deep. Eyes were pearl. Skin was pink, warm, and dry. SpO2 did go up to 96%. My patient stated that she was feeling much better. We went ahead and reassessed vitals, interventions, primary, secondary assessment, as well as chief complaint every 5 minutes en route, and I am done.